$500 billion in funding
upfront if we can.
because
Today we are
I have to be
reporting an additional
afloat and have some capacity to do all these things
test
you want the
results,
governors
and
to
a
now
total of
do.
71,030
And that has to be in the next
New
federal
Jerseyans
legislation.
have now tested positive.
And there can't be excuses about
According
it.
to our online
So from
dashboard,
today
accessible
to
again through
18 months,
covid19.nj.gov,
which is the
as of 10
last
p.m.
date
last night,
for a
8,000,
vaccine,
and Judy, you'll correct me if I get
that's
this
what
wrong,
we have to work towards.
8,270 residents
First
were
rule,
reported hospitalized,
do no harm.
of whom
This is a public health
1,980 were
crisis.
listed in either critical or
We're
intensive
still
care,
in the
and
woods. And just because
1,705
that number has
ventilators were in use.
plateaued doesn't
39
mean
patients are
it's
at
any
one of our
time
field
to
medical
relax
stations.
what we're doing.
And
So
between
do no
10
harm,
p.m.
don't
Monday
go
and
backwards.
10 p.m. last
Hope
night,
we find a medical treatment between now and
709
18
residents were
months.
discharged
In the
from our
meantime,
hospitals, and that's good
testing,
news.
tracing,
Additionally, we are
trying
now
to get that
adding
up to
daily
scale,
reports from
which
our
is going to
3
be
veterans' homes
the
to our
equivalent
online
of trying to
dashboard.
get Apollo 13
We know these
back to
facilities
Earth,
are a specific point of
220,000
concern,
miles,
as they should be. God bless
50
our
years
veterans.
ago. It
And
is a
especially,
very
obviously, for those
difficult,
veterans themselves who are living there.
task.
We
It
must
can't be
remain
done
at all
perfectly,
costs
I can
committed
tell
to
you
that.
that right now.
These reports will
But
be
we can
updated
do
when the
better
Department of
than we're
Military and
doing.
Veteran Affairs
And at the
receives
main-
their data from
In
these
the
homes,
meantime, a
I believe, at
phased
approximately 3
reopening
p.m.
of the economy
So more on
as
that as we get it.
educated
As we note
by
every day, all of
testing
these
tracing.
numbers are
And
just
one
a
other point on
snapshot
the
in
phased
time.
reopening. What
Overnight
does that
changes
mean?
or late reports may not
And
yet
how do
be
we
reflected
phase
in the
this
data
reopening
that is
until
posted.
we get to a
And
medical
remember, too,
treatment
that for our
or a
healthcare
vaccine?
facilities, this
This is
remains
what,
a very fluid
we're thinking
situation.
we
Sadly, and
need
with the heaviest
clarity
of hearts, we also have
on
the
what
duty
the
to
federal
report another
government is going to do and what the
351
state governments are going
deaths
to do.
among our extraordinary
I heard the
New Jersey
president last
family due to
night.
COVID-19
The
related
states, it's up to the
complications.
states,
The
basically.
overall cost in lives to our
Great.
state,
I get it.
COVID-19 now
and the
sits
states
at
can do no harm. It is their
3,156
job to
blessed
do the
souls.
public health monitoring.
I do want to put a
states
couple of
can
numbers
also,
into a broader perspective, and
do
Judy and I
the
have
phased
hit this point, but
reopening
I think it's
plan.
worth hitting
We
again.
cannot
First,
do,
the number
the
of
states
deaths
that
that
have a
we
large
report on
problem
any given
cannot
day
do the testing and tracing.
does not mean that we lost that many
without
residents literally in the
federal
past
assistance.
24 hours since we were
and
gathered.
that's important.
In some
On the
cases, these are
reopening, we can
residents
do,
who we have lost
and we have a
within the
blueprint
past
for the
several days.
reopening.
But the determination
Again, as
into the
guided
cause of death
by
remains
testing tracing. But
means that now we
there
are
are two
counting them
factors
among
really
our
in the reopening.
COVID-19 losses.
How essential
There have been several reports in
is the
particular
business,
about the number of deaths
service, or
announced
product
yesterday.
or function.
And while, yes, yesterday's number was our
the
largest
more
single
essential
reporting number,
a
and today's
business,
is
service,
right
or
behind,
product,
a significant
the
number
more
of these deaths
urgent the
occurred
need
over
to
the Easter
immediately
weekend
get them
and are
back
only now
online,
being
or
reported.
as
Is
soon
that
as
fair to say,
possible.
Judy?
So how
Additionally,
essential
the overall
is what the
number of
business
positive
does.
test results we
And then
report
second,
is cumulative
what is
since our
the
first
risk
case
of
was announced
infection
on March
spread of
4th.
that business?
Of these, roughly
Some businesses can
54,000,
say,
of
"I
a
can
total
open
of just
tomorrow.
over 71,000
In my
have been
business,
reported in
I'll
the
have all
month of
sorts of
April
precautions.
so
People
far.
will not be
And given
less than
that
6
it's
feet
April
apart,
15th,
period.
and I think
There will
the
be no
experts to my right would suggest
congregation
plus
of
or minus a
people.
2-week
I won't do
incubation period is
conferences, I
still
won't
the
do joint
expected
meetings.
reality
It's not the way
with
my business
coronavirus.
operates.
That
I can
means
bring everybody
approximately
back, put them in separate
17,000
desks.
individuals
They'll never
have
be
now
near each
exited
other. I
that
have a
2-week
very low
incubation
risk of infection
period.
spread.
Sadly, we've lost some of those folks.
Businesses
Let there
can
be no
start
doubt
to
about it, but it is
redesign
a
their
fact, plus or
workplace
minus,
to
that
think
about
that way. All right, so
17,000
your
are outside
business
of that
poses a
incubation
low
period.
risk of infection
So as
spread.
we see the daily
That's the second
overall
factor.
number
And the
of
first factor is
overall
how
positive
essential
test
is
results
your,
rise, we should also
business.
keep in mind that every day
So,
there are hundreds, if
that
not
is
thousands,
a-
of residents
almost a
who had
business by
received a
business
prior positive test result
evaluation that has to
who
go
have now
on.
likely
And
defeated
then,
the
once
virus
you
and may it stay
determine
that
the
way.
essential nature of the business.
These are just
because right now we have all,
contextual
quote-unquote,
aspects to these
essential
numbers that I think we
workers
should
who
all
are
bear in
working,
mind.
right? This would
They
be,
should not,
well,
however,
what's
be
the
seen in
next
any way
tranche of
as
essential
lessening either the
workers?
gravity of the situation,
And
the strain on our
how
healthcare system and our
high
state,
or low
or our
is the
need for preparedness.
possibility
And
of
they in no way
infection
ease the
spread
pain
if that
of the
business
families who have
becomes
lost loved ones
operational. And
and
then
the
you basically
communities who
have a
have lost
matrix
people who made life a little better
where
and a
the
little
lower
brighter in
risk
all of
of
the above
infection
cases.
spread
I'd like to remember,
and
if
the
I may, 3
higher
such individuals today.
nature of essential
First up,
services
Eugene
are the
Gene
businesses
Thomas.
that you would start
There he is on the
prioritizing,
right.
right?
Again, a guy
So
known for his
that's-
hats, and he's wearing
That's how we
a pretty
will
cool one right there.
inform
He was a fixture in his
our
beloved
economic
Ridgewood in Bergen County.
reopening
where he
as
lived
we're
his
being
whole
guided
life.
by the
And
testing
here he is with
tracing,
Ridgewood Mayor
and as
Ramon
we're
Hush.
making sure
He had
we're
just
not,
turned 78 a few
jeopardizing
weeks
the
ago, I believe,
success
on the
we've
day that he was
made
admitted to the hospital.
in handling
As
the
his daughter
public health
Jackie
issue.
put it, and I spoke to Jackie
That's
earlier today,
the
even though
whole
some may not have known him
outline,
personally,
the whole
they
vision
always
from
would see him
here
in
to
town,
18
walking down
months,
the avenue
building
with
that
his hat on and
bridge
carrying his
to
beautiful
the
smile.
new normal.
He was also apparently
for the
somewhat
economy
famous for baking
until
pound cakes.
we get
He
to a
worked in a dry
conclusion.
cleaning business.
In the meantime,
but his love was music,
for
everything
today,
from gospel to
stop the
blues.
spread.
And the music he recorded in the
I'm going to show you a chart in the
1960s
next couple of
is
days.
still played today.
We've been tracking the
He leaves his daughter
infection
Jackie and
rate,
her family 3 granddaughters
which is what?
and a
Which
grandson
is
who is due next
one
month.
person.
He's also
How many
survived by his
people
brother,
does
2
one
sisters, nieces,
person
and nephews,
infect?
and a tremendous community of friends.
Does one
I
person
spoke to
infect
Jackie, as I
one
mentioned.
person?
She is
2
in
people?
Florida, and
3
because of
people?
all that we're going through, could not even
That
get up here to be with
rate
her
of
dad.
infection
And so
is
our
the
heart goes
difference
out to her and
between
her
a
family and
manageable
his memory.
situation
Next up,
and
Lieutenant
a pandemic.
Danny Francis. There's
And they
Danny.
can
He worked
they
for
can
nearly
calibrate
16
that
years
for
for the Essex
what
County
Wuhan
Prosecutor's
did, where
Office.
we
So to Ted Stevens
are
and team
now and where
at
we
that
were.
office, our
And
hearts
it
are
is a
with you.
fascinating analysis.
After retirement, he kept
But in
going
the
as a
meantime, what do
civilian
we do
analyst
today?
for
We
the
have to
Newark
continue to
Police
stop the
Department.
spread.
And to our brothers and sisters
and,
in the Newark Police Department, our hearts
this
go
is
out
a
to you there as well.
constant calibration
Danny was only
also.
51 years old when we lost him on Monday.
I'm going to issue an executive
To know a
order that
little
says
bit
all
about his
people in
career,
public
consider this. In
must have a
2006, he
mask
was
or
recognized by
nose
the 200
covering,
Club
mouth
of
and
Essex
nose
County for
covering.
valor in the line of
And
duty
they must
for
wear
risking
it
his
in a
own life to
situation
take down
where
a
you
known
cannot
drug
or are
trafficker.
not maintaining social
He leaves
distance.
behind his wife,
Meaning what?
Sarita Vega, and I spoke
Meaning
to
the same thing we've been
Sarita
saying
as
from
well
day
this
one.
morning. By the way, she
If you're
herself
gonna be in
is a
public,
detective with the Essex County Prosecutor's
and
Office.
you cannot
He leaves
maintain
his
social
wife,
distancing,
Sarita, along with 2 adult
then have a
children,
mask.
another who's in
and
college,
put
and
the
a
mask
6-year-old son.
on
So on
when you
behalf
are
of our
not
state, we
in
thank Danny for his
socially
career
distant
of public service and for his
places.
longstanding, excellent
You're
work to
walking down
keep
the
our
street, you're walking
neighborhood
down the
safe.
street alone.
We will keep him
Great.
and his family in
You
our
are now
thoughts.
at an intersection,
our
and there are
prayers.
people
God
in the
rest his soul.
intersection, and you're going to be in
And
proximity
finally, we wish to
other
recognize the
people.
legacy of Jacqueline
Put the
Cruz
mask
Towns.
on.
And there she is on the right.
Your
Many may
right
know her
to
as
go
the
out for
mother
a
of New
walk in
Jersey
the park,
basketball legend and NBA star
go out for a
Carl
walk
Anthony
because you need to
Towns,
get out
but
of
she
the
was
house.
much more.
The dog is
She
getting
was a
on your
family
nerves.
matriarch and an enduring
Fine.
and constant
Don't infect me.
presence
You don't
not
have a
just in
right
her
to
son's
infect
life,
me.
but that of everyone who knew her.
If you are
She
going
also
to
had
be
spent, by the
in
way,
a
20
situation
years
in public
working at Rutgers
where
University.
you may come into
Her
contact
husband, Carl
with other
Sr.,
people
also
in
contracted
a
COVID-19,
situation
but is
that not
recovering,
socially
and we keep
distanced,
him in our
you
prayers as
must
well.
have a
One
mask
story noted that it may have
or
been
a
Carl Anthony
cloth
Sr. who taught his son the
covering
skills
nose
to play
and
ball, but
mouth.
he got his emotional spark from his
That
mom. She was
is by
only
executive
58
order.
years old.
So
To Carl Anthony and
if
his
you're going
dad,
to
and I
get on
spoke
public
with each
transit,
of Carl
you're going to
Anthony
get on
and
a
his
bus,
dad this
you're going
morning,
to get on a
and
subway,
their entire
you're going to
family and
stand
the
on a
broader
subway
basketball
platform,
community, we send our
you're going to
deepest
walk
condolences.
in a
God rest her
neighborhood that is
soul, and I
busy,
can say
you're going to be on
today,
a sidewalk,
without any
you're
doubt
going
in
to
New
pass other
Jersey,
people on a
we are all
sidewalk, you're not going
Timberwolves
to be able to
fans
maintain social
today.
distancing.
These are
You
only
must
3 individuals
wear
out
a
of what
mask.
is now
Or
3,156
cloth,
lives
or an
that we have
attractive
lost to this
bandana,
disease.
or a color
We don't
coordinated
take any
bandana,
pride or
cloth.
joy in recounting these stories,
you have to
saying
wear
these
it.
names and seeing these
In those
faces and knowing there
situations.
are quite literally
We'll give people
thousands more
3-day,
we can memorialize does not
notice
make our pain or your
allow
pain
compliance,
or any of our pain and grief any less. But
just
these
on the
lives
off
should be
chance
the
that somebody doesn't
inspiration
have
we
a
need
cloth
to
covering
keep working to
or a
defeat
mask,
COVID-19
we'll
and
go
to
from
lower
there.
the toll
On the ventilators,
this enemy is having
we've stabilized our
on our
healthcare
blessed
situation.
state.
New York had one of
I've
the
said it
earlier
many times before, we have
curves.
taken among
There
the
are other
most
places in
aggressive
this country
positions
are
of
now
any
seeing
state in
increases in the
America
death
to
rate,
slow the
and there's
spread
some
of this
stress on the
illness.
healthcare system.
We have asked you
I
to
will
make
never forget
tremendous
the generosity
sacrifices with us in this fight.
people across this
I know
country
some of them
showed
may
to
seem like
our state,
nuisances, but
and I
every
said at
step
that
we have
time,
taken has
New
been made out of
Yorkers
sheer
are
necessity. I
generous,
promise you
and
that.
they are
I'll turn to
grateful
a map
and
that we've been
gracious,
looking at
and when you need
every
help,
day
we will
recently.
be
The lighter
there
the
for
shade
you.
of the county,
And we will
the
be.
better it is.
State of
And we're
Michigan
getting
is
New
going
Jersey
through an issue
lighter
right now.
and
State of
lighter, and
Maryland
that's
is
a
going
good
through an
thing.
issue.
The
We're
less bright
stabilized.
orange,
visualized, we're
we
gonna send
see
100
the slower
ventilators to Michigan
the
and
spread.
50 to
That
the
means we're
state of
flattening
Maryland.
the curve, which not
Last
only
point,
means we're
personal
keeping
opinion,
people from getting
build the bridge.
COVID-19, but that we're also
built
lessening
the
some
bridge.
of the immense strain on our
And I learned a
healthcare
lot by
systems.
building that
We're
bridge.
continuing to do everything we
And
can to
it's
prepare for
a
the
lesson that has
absolute worst.
informed me,
As we've
and
said,
a
we've
lesson
already
that,
been able to increase
I think should
hospital
inform
capacity
people
statewide,
who
Judy,
are
I think by
hearing about us
60%.
needing to build this
We've
bridge.
set up 3 field medical
was a bridge
stations in
across the
partnership
Hudson
with the
River
Army,
called the
U.S. Army
Tappan Zee
Corps of
Bridge.
Engineers.
It was
And we've had
in very
beds
bad
set
shape,
aside
had been
for
in
our
very bad
residents
shape for 20
on the
years.
USNS
20
Comfort.
years,
By the
everybody
way, I
talked
mentioned
about
this
we're
the other
going to
day. I want to
replace
put a
the
name
Tappan Zee
on
Bridge.
this,
Nobody did.
who's captain, and not today,
Tappan
but
Zee
at
Bridge
some
was
point,
in such
Daniel, let's
bad
get
shape that there were
Captain
actual
Joe
holes
O'Brien's
in the
picture up
roadway
here.
that they would put
He's a
these
New
large
Jersey
metal
native, and
plates
as my
over.
son Sam reminds me,
And when
he
you're
is a
driving across
graduate
the Tappan
of
Zee,
Red
go over
Bank
one of these
Catholic,
metal
by the
plates, and
way.
the plate would bounce
Nothing,
over.
however, and I do mean nothing,
And
would
you
make
could
us
actually
happier
see
to come out of this
glimmers of
realizing that we
light
are
that would
over-prepared.
come
That would be our
through
new
the
best-case
hole
scenario,
in
the best
metal
mistakes
plate.
we ever made in our
Traumatized
lives.
2
Because if
generations
we
of
do,
drivers,
that means
me
that
included.
you will have done the
And
hard
government
work
kept
of
saying,
helping us
yeah, we have to
pull through
replace this
this.
bridge, we have to
It
replace
means
the
you
bridge.
took
Never did.
to heart our call to keep
I
a
became
social
governor.
distance,
I
not just
say,
most of the
we have to
time or
replace the bridge.
sometimes, but at all times,
Whole
and to stay at
raft of
home
bureaucrats
unless you
say to me,
absolutely
I mean that in a
need
nice
to
way.
go out, or unless you
You know
are
what?
needed as one
It's
of the
too
folks
risky a venture.
who are either an essential
It
worker
goes across
or
the
helping
Hudson
us
River. The Hudson
fight
River
this
is an
virus.
environmentally sensitive
This is
place.
a war.
You
It
try to
is
build a
the
bridge
fight of
in the
our
Hudson
lives.
River. You have to
And
put
wars
down
are not won by
piles.
one
You have to
person
do all that
or one small
construction.
group.
It's
They're
going
won
to
when
annoy
millions of people
environmental
come
concerns.
together in a common cause.
It's going to be very
Our cause
expensive.
right
It's a
now
very
is totally
high
flattening the
risk,
curve and then
difficult
seeing it drop
project.
down the other side.
And they cautioned me
we can
not to do
begin
it.
the process
And by the way, for 20
responsibly,
years,
along with our
nobody had done
neighbors,
it.
of reopening our state
I said, yeah, but
and
then you don't
beginning
build the
to
bridge.
live
I understand
life
the risk.
in our new
I understand
normal.
you could get
But we
blamed.
only
I
get
understand
there
something could
if this
happen.
entire
I
map in
understand
front of
whatever
us
you do
gets
in
to its
life.
lightest shade and
People are going to
stays
have 57
there.
different opinions.
This is no
And
time
it's
to
never
let
going to
up.
be perfect.
We have
And
got
yes, they can always
to
write
keep at it. I just
stories.
have to say this
one
again.
criticized
Although
this,
I
this
think
one
the weather for the
criticized
next
this,
few days is
and
not
we
going to
love
be terribly
negative
hospitable,
in society.
but it's going to be sooner than later. The
reason.
weather will get better.
But then you
All
don't
of
get
us are
anything done.
anxious to
Long
break
story
free.
short,
We completely understand
built
that.
the
We
bridge.
accept that completely.
On time, on budget.
We can't.
It's
We have
beautiful.
to stay home. Look at the progress we've made on
We
that
did
map.
go through
This is
all the
making a huge
heartburn
difference. That curve of positive
going
test results,
through a construction
undeniably,
project
10 days
in the
now,
public
is
domain.
increased at 10% or now
Yes, many
meaningfully
people
less.
criticized.
We
We
need to keep
picked
it
blue,
that
they
way.
wanted green,
We need
we
to
did this,
flatten
they
that
wanted
curve,
that.
which means
That's the
fewer
nature
people
of
get
people.
infected, fewer people in hospitals,
we did
fewer
it.
people
We
in
did it.
intensive care,
And it is
fewer
a
people
beautiful
needing
symbol for
ventilators,
me.
and please God, fewer people who
And for
pass.
anyone who sees it,
And as we continue to
Don't
do that,
tell me
Judy
that we
and Christina
can't
and
do it.
Pat and all of their colleagues
Don't
are
tell me we
building
can't
out
do
that
it.
capacity of
Because
beds,
I know that
beds,
we
healthcare
can
workers,
do it.
ventilators,
Because we
medicines,
did
personal
do it.
protective
And we
equipment.
did it very
Again, so
well.
that those two lines cross
Have we dealt
at a
with a
reasonable
situation like
level
this?
and at a
No.
reasonable
Can we
date.
build a
That
bridge
is the
that takes
charge
us
to
from
the
today
9 million
to
of us.
18 months?
So far,
Yes.
so good.
Yes.
No state
Because
has come
we are
close
bridge
to what we've done in
builders.
New Jersey.
That's what we do.
We could all
build
not be
bridges.
prouder of the work that
Sometimes
everyone is
literally,
doing. We just got to keep it up.
symbolically, sometimes
Don't take your foot
metaphorically.
off the gas, folks.
But we
Stay on
build
this.
bridges.
I know
The
you're
bridge can be a
itching to
bridge,
get out.
it can
You're
be an
itching to get
airport,
back to normal.
It can
So
be
am I.
new
Who could
civil
blame
rights
you? We can't.
legislation, it can be
We
new
just
labor
can't yet.
rights legislation,
I
new
promise you,
minimum
the
wage
second we think we
legislation,
can,
but build
we will let you know
bridges.
that. You have my word.
what we do
But
in
for
New York.
now, stay
And we're
home.
gonna do this.
Stay 6 feet or more
Questions?
apart.
Governor, on the mask
By the way, I meant to
issue,
say this, Judy.
so this will
There have
be
been
any
some
public
great
space where there
homages.
is
I saw one.
congestion,
Vingo
where
Paul
busy
sent me an
streets,
homage
stores,
for healthcare workers
we're just
gathering.
trying to
Pat, you were on the
determine what
text
this means.
somewhere in Monmouth County over the past
Any
couple
situation
of days. So the good
in
news is
public
everyone had a mask on.
where
The bad news
you
is
cannot
they weren't 6 feet
maintain
apart.
social
And again, I want to
distancing.
repeat, unless you and Dr. Tan disagree, that nothing trumps
6 feet.
social distancing.
If you
6
can't
feet
maintain
apart
that
at
social
minimum.
distancing,
Putting a mask
because you're
on,
going
even
through a
a
congested
crazy
area,
one like this,
or it's a
does not
situation where
give
you
you
can't
permission
maintain social
to get
distance.
closer
You
than
cannot
6
maintain
feet.
social distancing on public
So
transit.
please, folks,
Can't.
we want to celebrate our heroes and
You
healthcare
can
workers,
on
first
the street that is
responders,
unoccupied.
essential workers,
But if you're
warehouse,
going out
supply
for a
chain
walk
workers,
and you may
longshoremen.
come to a place
We want to do that with
where
you.
You
But
can't
we
maintain
got to
social
stay apart from
distancing,
each
you
other.
have to have a
We
mask.
cannot congregate even if we're wearing a mask. Stay on it,
There's
folks.
a
You've
possibility
done an
for a civil
extraordinary job.
violation. You could get a
We will
penalty.
win this war,
You know, you jaywalk
unequivocally,
theoretically, you get a
but
penalty.
only if we keep at
Local
it.
governments would
Please,
enforce
folks,
it. I don't
stay
wanna
at
go
it.
to a
Stay
penalty
home,
yet.
stay
I
apart,
don't
keep
think
your
it's-
face
we
covered,
haven't
and we
seen,
will beat this damn virus. Okay,
flagrant
switching gears. Good
non-compliance.
conversation this morning with
So
Secretary
there won't be a penalty,
Mnuchin.
But it is an executive
Talking
order.
about,
I'm directing
again,
if no
the
one, if
important
people don't
need,
follow it,
the
we could do
overwhelming
a
need
civil
for support
penalty.
and financial help from the federal
You're not gonna go to
government.
jail
And he
for not
gets
wearing
it
your
to his
mask,
credit,
but,
and we're just working through. I spoke to
if we
Senator
get there.
Menendez
But for now,
shortly
no,
thereafter
there's no
and
civil
reiterated
penalty.
the same point.
But
Individuals
local
needed
governments
who
should
are
start to
unemployed.
enforce
We've got
it,
an
and they should
extraordinary,
come up and say,
over
you know, Jesse, you're supposed to be
500,000
wearing a
people have lost
mask.
their job.
And by the
Small
way, people
businesses
will
need it
enforce
in a
it.
big way. The
They'll
state of
say
New
to
Jersey
you,
needs direct
if they're standing
cash
next to you on a
assistance
street corner,
from the federal government.
where's your mask?
It was a good conversation, again, a good conversation
In a
following
nice
that
New
with
York
Senator
way.
Menendez, comparing notes generally and also mentioning this point specifically. On testing, as the slide suggests, of our 2 FEMA partnered testing sites, both tomorrow,
interests?
April 16, and Friday, April 17.
Two
So I want to make
interests.
sure everyone hears that, both
One
tomorrow,
interest
April 16,
is
and Friday, April
release as much
17.
data as
Only the
possible.
Bergen Community College
We
site will be open
release as
from
much
8
data
a.m.
as possible
Each day,
on
maximum of
people who have died
500
in nursing
tests.
homes.
Again, you've got to be a
Second
Jersey
interest
resident
is,
and symptomatic. The PNC Bank Arts Center
respect
will open again
and
on
legal
Saturday,
rights
April
to
18th,
privacy.
and that will be exclusively
You
for
pass
symptomatic
away
first
in a
responders
nursing
and
home,
healthcare
or your
workers.
parent
It will
passes
reopen to
away
the
in a
general
nursing
public
home,
on
God
Monday,
forbid.
April 20. Again,
Should your parents'
repeat, Bergen
picture
Community
really be
College,
on the
April
front
16 and
page
17,
of the
so
newspaper
tomorrow
the
and
next
Friday.
day because they passed
PNC
away
Saturday,
from
just for
COVID?
symptomatic
Did that mean
first
their
responders and
privacy
healthcare
should be
workers,
violated?
and then
And
they'll
I
go back
should
to a
release
regular
their
schedule on
name
Monday. I mentioned this
so that they could
yesterday.
be on the
It has been
news that
clear
night?
that we have had a
You know, so that's the
imbalance
balance.
between
I've
folks
said to
showing
them,
up to get
err
tested
on the
at
side
the
of
Bergen
more
Community College
disclosure,
versus Homedale at PNC
and
Bank
that's
Arts
what
Center.
they've been doing,
So
and that's
again,
what they're gonna
words to
continue
folks
to
out
do,
there,
but don't
as you're
discount
thinking about planning your days,
person's right
this
to
is really
privacy,
relevant for next
about
week
the
because
death of
we'll
a
get a
loved
different
one,
schedule for the next couple of days.
your
Think
right
through
to
whether or not you can
publicize
pivot to
that
Homedale
death
because the
you
lines
want
have been
to.
shorter
So it's
there.
a balance.
There are
just
now
a minute.
roughly 24 publicly
Okay.
accessible
Well,
testing sites
I got it.
across the state that are listed on our information
people
hub
are.
at
Maybe you're not, but people are.
covid19.nj.gov/testing. Additionally, there are roughly 40 more privately run sites that your primary care practitioner can send you to for testing if you meet the requirements for testing. I think in total, the number remains at about 66 locations in the state. We have been in regular, I would say constant and deep contact for some time with the
Melissa can
team
talk
at
about the
Rutgers, especially with
overall
Dr.
coordination.
Brian Strom.
We have
And Judy mentioned
we
this
have
yesterday. We've also been in discussions with the White House. The president mentioned
400
Rutgers in a shout out yesterday,
local
which was
government officials
nice
in
to
the
hear.
state. This is a statewide
And the White House, who notified, by the way,
of
this past
700
weekend of the
school
FDA approval
districts.
for the Rutgers
I
developed
have
saliva
50
test and the
something
potential
county
for this new
executives.
system to be put in widespread use
coordinate as
to help
much
us
as
meet
we
our
can with
testing needs. In
everybody.
addition to Brian Strong, I reached out
Local
this
governments
morning and left a message for Professor
should
Andrew
and
Brooks, who's part of that
must Be
team.
doing what they think is necessary.
We are working intensely with
And then we
Rutgers
have
and specifically now with
statewide
Middlesex County
directives that
today to
everyone
roll
should
out this
do,
new
because we have to
testing
have one
system,
state
and we will
plan,
closely
right?
monitor how
And then
everything
I have
goes.
to turn around and coordinate with
Nationally,
New
and
Jersey,
you've heard
and
this before, but it
Connecticut,
bears
and
repeating,
5 other
resources
states.
and PPE
So
have been
we have to have
limiting
one
factors
state
to the
plan.
testing regime. And we know
And
what
then
we
I
need,
try
and
to
we will
coordinate
advance
now,
every
and I try to
opportunity
coordinate up with
to
the federal
increase
government
mass
and all
testing.
this
It is
coordination.
incredibly gratifying. I think it's a source of
so
great
you do the
pride
best you can,
for all of us to see New
but
Jersey's
when
own
you have a
flagship university
statewide
stepping up
situation,
to
which
help
is what
fill the
this
testing
is,
gap. I
you
am
have to
proud
have
of the work at
rules that are
Rutgers and look
statewide,
forward to moving forward
try to
with them. And I know
coordinate with
Judy and her
everyone.
team joins me
They can
in
have
that.
their own rules.
As I said yesterday,
just can't
we're not alone
conflict
in our
with the
desire to have
statewide
more
rule.
sites and more tests. We've
That's
wanted that from moment
the
one.
balance,
Every
that's
state in the
law.
entire
So they can
nation
do
is facing the
anything
same
they
issue
want,
we
just
are.
they can't conflict.
But as I also noted,
There
we
will be
also have
times when they
conducted the
take a
fourth
local
most
action
tests of any American state.
Which
And the
happens
only states
usually
which have
also.
conducted more
They take
state
a local
tests
action, the state then
are
takes an
states whose
action, the state
population are
action
significantly
overrides the
larger,
local
New York,
action.
California,
Whether it was plastic
Florida.
bags or
This
whatever.
doesn't mean, however, that I'm
A
not
lot of
continuing
times
to
we get
push
into
for more
situations
testing
where you have a lot of
supplies
local
and
laws,
support at
different
every
local
opportunity.
laws.
I've made this
And
clear
then
to
the
the White
state
House
takes an
and to
action
our
which overrides
congressional
the local
delegation.
laws.
And we've seen some successes.
That's not just in this
and we've mentioned
situation.
this
This is just a more
we have received the
condensed
commitment from
version of
FEMA
it.
to keep our partnered sites at
So,
both Bergen Community
I don't
College
know
and
all
the
the
PNC
local
Bank Arts
laws
Center
that are
up
out
and
there
running
on masks,
through at
to
least
tell
the
you the
end of
truth.
May. And we are a rare
And
state
as long as they don't
that got that
conflict-
support. And as I
Right.
said,
But
I
if
will not
there's a
let up until
conflict,
we
the
have
state
everything
law
we
governs.
need to successfully fight
Bernadette, I could just follow up
COVID-19,
on
whether that be testing
So,
supplies, personal
the details
protective
here are
equipment,
obviously important. What the
ventilators,
mayor announced
you name
yesterday
it. We're going to
was
turn
that
over
he's gonna move
every
into
stone
the new testing
anywhere
system, that they're
literally
gonna be
in the
acquiring
world
testing
to
systems.
get what New Jersey
What
needs.
he's talking about is the
And of course, by the
swabs
way, at
and
the
the
same
vials
time,
that they
we're
go
going to
in.
continue to
What
ask
the governor is talking about
each
is
of you who
testing
can help
capacity.
us to
We've been
please
limited
continue
by
to
the
step
testing
forward.
capacity in
If
the
you have
labs.
any
So there's
PPE to
two parts
donate,
to that. There's
no
the
matter how
swabs that you
large
use
or
to actually
small
get the
your
sample,
stockpile,
and then you send it to
please
the
reach
lab,
out
and
to
you are
us at
constrained by the testing capacity in the lab. So the governor's talking about is increasing the
COVID-19.nj.gov/PPE
capacities
donations. You
in the
can see
lab,
the
and we are
website
working
right there.
hand in glove with the city on
Or
that and all of our local
manpower.
governments.
If you have
On
prior
masks, yes,
experience
I've
as an
been speaking to the
EMT
city. We're
or a
fully supportive of
paramedic
what they
or as
said
a
this morning in
physician
grocery
or a
stores,
nurse
and we discussed
or a
it, and here's what the
respiratory
next logical
therapist
step was
or
to build
any
on
of
top
the
of
other
that.
medical specialties, we
maybe
need
just
you
just
among our
understand
volunteer corps. Please
and how
visit
complex this is. The first issue is you can't bring it to
covid19.nj.gov/volunteer, as you can see, to
forget
sign
that.
up.
Before you even get there,
Couple more brief
you
items, Judy,
can't
before I turn things
get
over to you, if I may.
enough equipment, testing
First, I want to
equipment,
recognize
swabs,
another one of the
vials.
truly good
It's literally
stories that's coming out of this
the
emergency.
material that you need.
And this one
When
was
you
sent
talk
to
a
us
private
by our
sector
dear
company,
friend and
this is
great
all done by
leader,
private
Senator
sector companies.
Loretta Weinberg.
When you talk to them about
And Loretta lives
how
in
do you
Teaneck,
triple
which we know has been
capacity,
one of the Bergen
they'll say,
County
"I can't
communities
get the
most
swabs.
impacted
I
by
can't get the
COVID-19.
vials. I
In fact, you
can't
could
get
take
the
Bergen County out of that
physical
statement. It's one of the
equipment."
communities that's been most impacted
That's one step.
in this
They'll then
state,
say, "I
if
can't
not
get the
this country.
testing agents,
The science director
the
from the Teaneck
chemicals that they
schools,
need to do the actual
there he is
testing." They'll
on the
then say, "I
left,
don't have the
Rolando
machines that
Montserrat,
can do the testing."
came across the
you have
plans
that whole supply
online
chain.
for producing
On
face
top
shields.
of it, you
And
have
his first
people
thought was how to make enough to
contracting
make a
for
difference.
tests.
Using his own personal
All the
3D
states,
printer and borrowing
the
three
federal
others
government,
from the Teaneck schools.
local
And
governments,
with the support, I might add, of the
cities,
Teaneck
counties,
PTO,
towns, all across the country.
and alongside
You
one
then
of his
have
students,
private
and that's the gentleman on the
companies
right,
that are
sophomore
trying to buy
Elias
tests.
Sanchez. He
Why?
has been
Because I
able
have
to
my
turn
workers
his
coming
home into a mini
And I
face
wanna test my
shield
workers.
factory.
I'm an
They
essential
just donated
service.
their first
I'm a
340
food
face shields
manufacturer.
to
I have
Holy
200
Name Medical
employees.
Center in Teaneck.
They're
And
going
God
out to
knows
buy
that Mike
tests
Marin and his
to
team
test their
at
200
Holy Name
employees.
could use all the help
All
they
of
can
this
get. They've been
volume
incredible
is
heroes in this fight.
descending on these
Additionally,
private
the
sector
Teaneck
testing
schools have donated the
companies
goggles normally set
that
aside for
never
use in their science labs
anticipated
and
this
gloves from their
tremendous
nurses'
volume.
offices to members
So
of
you're
the
one of these
township's
testing companies, they're
ambulances.
getting called from every
This is the essence of the community coming together.
Private companies, local
to the
government,
Teaneck Public
states,
Schools,
federal government. I need
NJ
more, I need more,
thanks
I
you.
need more.
And we ask you
so
all
you have
to
this
continue
whole-
highlighting the everyday
It's just
people
a
doing extraordinary
complicated,
things by
chaotic-
using the hashtag
It is what
NJ Thanks You
ventilators
on
was,
social
probably
media,
even worse.
and we will keep
No.
sharing
Can
their
the federal
stories.
government do this? No. Can the
Finally,
state government do
before
it? No.
I close, I
Can
want to
anyone
pay
do it? No.
tribute to two folks
But we have
who
to do
did
the
not,
best we can
Danny,
to
hold
try
on
to
a second,
figure
who did
out
not
how do you get the
literally
supply chain up,
die
where do the
directly
chemicals
from the
come from, what
COVID-19
countries do they
reality,
come from?
but they have passed.
And that has to
First
happen
one
with
I
the
just
federal
spoke to his
government.
widow, Ann Lozano, Gordon Litwin. Gordon was
John.
90 years old. He died again from reasons other than COVID-19. We don't have his picture because I called it audible at the line of scrimmage. Gordon was the chairman, however, of the Hackensack Meridian Health System.
I
Which
don't
is
know why the
extraordinary
park was
that
closed
Gordon
down.
left
Does
us
anybody know?
in the middle of this
Unless-
fight, and
There
his
were
widow Ann
complaints
said
for
to me
some- from some
unequivocally
local elected
he would
officials,
be
I believe, in
right
Rockland
there with
County,
Bob
and so
Garrett
the
and the rest
Parks
of the
Department
team
evaluated the
in the
situation.
engine
They
room.
decided to
He
err
was
on
a
the side of
giant in our
caution, and so
state.
they've temporarily
And Gordon,
closed the
God
park.
bless you.
Our
And
goal is to leave the state parks
we
open
wish
because, as the
Ann
governor said, we
nothing
do
but
want
the best
green
and have
space
her in
where
our
people
prayers.
can go and get fresh air and
And we
exercise
lost a
safely
dear
while
friend
able to social
and
distance.
great leader
So we're going to evaluate that
as
situation
well
and make a
yesterday in our
determination
state.
for the long term,
And a
but for the
dear
short
friend
term,
of
it is
mine,
closed.
Professional Firefighters Association of New Jersey President Dominic Marino. Not sure why, but known to many as Don, notwithstanding his name is Dominic. Again, we didn't lose him to COVID-19, but his loss leaves a huge hole in the hearts of many, including
Yeah,
yours truly.
look,
I
can
put
go
it
back and do a
last night in a
retrospective
statement, as a
sometime
firefighter,
when
Dominic
this is
would
over.
run
As
into
I said, I
burning
don't like to do
buildings,
Monday morning
but he would
quarterback
just
when
as
you're at
quickly run
halftime.
through walls
Because you're at
if it
halftime.
meant helping his fellow firefighters.
So,
There's
it's
a
not
reason
really-
his
I don't
members
know
look
how
to
this
him.
turns out.
He
I don't know
never
how it
stopped
turns out
working
New
for
York.
them.
I don't know how it turns out
Never
for the
stopped
nation.
thinking about them,
So,
and never
I
stopped
just don't see
living and
how you
breathing the
start to
life of a
do
firefighter.
game review while you're at the
Personally,
midpoint of the
Dominic was
game.
a friend whose opinion I
if
greatly
you
valued, especially
Forced
on
me
matters
for a
related
game review
to his
now,
members.
I would say, yeah. I'd
Whatever
like
it
to
is
know.
I
Let's
leave
go back
office,
to
one of the
December,
greatest days of
January.
pride that I will look back on
Who was
will be the
saying
day
what
that I
when,
signed the Thomas P.
where
Canzanella
was the
21st Century
international health
First
community?
Responders Act. That law gives our
President says,
firefighters
where
and
was
members
the
of law
World
enforcement
Health Organization?
greater
This
protections
is
when
not
their
my
health is impacted
world,
by their
right?
line of duty work, like
I
the
don't know who
illnesses that
should
many
have done
suffered as a
what,
result of their
when,
efforts
January,
at
February,
Ground
et
Zero
cetera.
following
On the
9/11.
New York,
Getting that law
is a
passed was one of his great
convenient
passions.
fact
It might
that
as well have been
people miss.
named after
there
Dominic,
is no
frankly.
state that
He was by
moved
my side when I
faster
signed that bill, and I'm
than the
forever
state of
honored
New
to have
York.
been the governor to
From
have
the
signed
time
it.
of our first
But beyond that,
case
wherever a firefighter or a
to,
department needed help, you'd
starting
find
to
Dominic.
shut
He was
down
one of a
to
kind,
total
a
shutdown.
firefighter's
that all
firefighter.
happened in like 19
To his wife,
days
Ellen,
in
with
the
whom I
state of
spoke
New York.
yesterday, and you can only imagine he
didn't
literally
have
dropped
a
dead
case
yesterday
early
afternoon.
on.
And their 3 children.
Remember, this
And I also
was,
spoke to his daughter Rachel and Patton,
Seattle,
as well as a
state of
Jersey State
Washington,
trooper and
California
someone I've gotten to
first.
know over the past couple of years.
It came
He leaves 2
to the
grandchildren.
East Coast
We
later.
thank you all for sharing Dominic with
from
us all these
time of
years.
the first
He will be
case
deeply missed
to
by
total
many
shutdown,
in this state.
New York State
So
was
to
the
you,
shortest
Dominic,
period
God
of time.
bless you, buddy. Thank
There
you
were-
for your service.
excuse me 1 second.
You will never be
And
forgotten.
then we
With that,
had,
please help me welcome the woman who
steps
needs
in
no
the middle
introduction, the
between,
Commissioner of the Department of Health, Judy
First case and
Persicelli.
total shutdown.
Thank you, Governor.
We did
Excuse me.
schools. We
The
did
Department of Health
25%,
continues to
50%,
work aggressively with our
75%.
partners
But the whole thing
to
was 19
expand our
days.
bed capacity in
And
the
what you
state.
also have to remember
The
is-
field
and
medical
just as
stations,
a matter
as
of
I've shared in the
days,
past,
on the factual
2 have
question
opened,
of
Edison and
speed
Secaucus,
of
and we expect
movement,
Atlantic City to
no
open next
state
week.
moved faster than
The
19
Secaucus
days
site
from
currently
first case
has
to total
47
shutdown.
patients.
Second
25
point
more
is,
will be accepted this
it was not
afternoon.
about my
And
declaring a
overall,
total
they have
shutdown.
already served a total of 79 patients
had been here
and
before,
discharged
and
32 of them.
Yeah, I can sign an
The
executive
Edison
order
Field
saying
Station
total
currently
shutdown.
has 14
And the people of
patients.
New York can
10 more
say
will be admitted this
what they
afternoon.
would like to say,
Overall, that field
which
station
you
has
said
served
nicely
19
is,
patients and discharged 5
I'm
to
not going
date.
to comply with that
These field
because
medical
it's
stations,
highly
along with the
intrusive,
brick
and
and
you have
mortar
not
hospitals that we're
shown
bringing up,
me any
will provide
need
more
for
than
that
1,600 additional beds in our state. And these
No,
beds,
I moved
in
faster
addition to
than
the
any
work
state
that
in
all
the
of our
nation.
hospitals have done to increase their capacity.
What else do you want? Yes or no?
The surge that we are in the north and expecting throughout New Jersey. Last evening, our hospitals reported 8,270 hospitalizations of patients with COVID-19 or persons under investigation. The daily growth rate in hospitalizations is 3%.
Yeah, we're not there yet.
Down from
There is no
the
civil
observed
penalty
rate
yet.
of 4%
There is no mandatory
yesterday.
eviction from a public
There are
transit.
1,980 individuals in
yet.
critical care,
Step
and
one is
1,705 of those
during the
individuals
report.
are on ventilators. That's
way I govern
21% of the
is I try to lay
hospitalized
out the
patients
facts
with
to New Yorkers
COVID-19 or persons under
and then
investigation
say, this
on
is what I
ventilators.
propose, given the
86%
facts.
of the
Right?
ICU
Start by
patients
saying, here
are
are
on
the facts. It's not my
ventilators,
opinion. Just here are
slightly
the
down
facts.
from that peak of
Then I'll offer my opinion,
97%
and you can throw
a
it out the
number of
window,
days ago.
throw it in the garbage pail.
Since April 4th,
Then I'll say,
there
this is
have
what I
been
propose based on the
6,300
facts.
patients diagnosed
Our
with
success here has
COVID-19
been the
or
very
persons under
high
investigation
compliance rate
discharged from our
with a
hospitals.
very
So while the
aggressive
numbers we
policy that
report
came out of
every
the blue.
day are
And
grim,
just think what you're asking people to
over
do.
6,000
Stay home
discharges serve as a
and don't go
reminder
outside.
that people are getting
Why
better
would you ever
and
believe
they
New
are
Yorkers would comply
overcoming
with
this
that?
illness.
I
As the
think we
governor
were
said,
very
we are still
effective
looking for
at
healthcare
laying out the
professionals
facts
to
and
volunteer.
explaining why.
The state is in need
They're
of
staying home,
EMTs
not because I'm
and
giving them a
paramedics
ticket
to support
or
our current
because I'm
workforce.
saying you'll go to jail.
Individuals whose
They're staying
EMT
home because they
certifications
say,
have
"I heard
expired
you,
within
and
the
it
past
makes
5
sense
years
to me,
are
and I'm
eligible
doing it."
for COVID-19
Because it makes sense to me.
EMT
So
reentry.
I haven't
We've
given
also
anybody a
granted a
ticket
waiver for EMTs from
for
out of
running
state
a business.
who want to
I
help
haven't
us
given
here
anybody a
in New
ticket
Jersey.
for
To
violating
sign
anything.
up, please visit
It's because they understood the facts. Where I am now, I'm saying, here are the facts.
Additionally, We still need
Stopping
nurses'
the spread
aides
is
for our
everything.
long-term care facilities,
How can
and we're
you not
encouraging
wear a
all
mask
student nurses to sign up.
when you're going to come close
Today,
to a
we are
person?
reporting
On what theory would you not do that?
2,625 new cases
Now,
for a total
if they
of
don't accept that, and there's widespread
71,030 cases in the
noncompliance, can we
state.
go to civil penalty, or could I say
Sadly,
you can't be on
351 new
the trains
deaths
or buses
have been
unless you wear
reported
a
to the
mask?
department for a total
You
of
could get there. I assume that's what
3,156
Philadelphia
fatalities
did
in
if they
our
said they're
state.
taking a person off a train.
55
But we're
of
not there
these
yet.
new
And I
deaths
hope
were
New
residents
Yorkers
of
will
long-term
do
care
it because it makes
facilities.
sense.
The deaths, 51.7%, are documented as white, 21.9% Black, non-Hispanic, 15.5% Hispanic, 5.7% Asian, non-Hispanic, and 5.2% other
Yeah,
non-Hispanic.
I want to know
On
why.
the underlying conditions, the
Governor, regarding the pay freeze,
I know why. So you wear a mask, you keep it below your chin,
37% diabetes
and then
mellitus,
when you are running and you come close to a
29.6% other
person,
chronic
you
diseases,
either run across the street, or you
20.9%
put the
chronic
mask
lung
up over your
disease such as
mouth
asthma,
and nose.
emphysema, or COPD.
So, look, it's not the biggest inconvenience in the world, right?
15.3%
It doesn't have to be a
chronic
surgical
renal
mask. It could be a cloth
15%
mask.
neurological or
Have it with you,
neurodevelopmental
and if you're in the
disability,
walk in the woods
and
and you don't see anyone,
11.4%
great.
cancer.
If you're in the walk in the woods and here comes John Campbell,
There are currently
because that's what he does a lot, is walk in the
358
woods,
long-term care
and you happen
facilities
to
in
run
the
into
state,
him, then you have to put up your
documenting
mask,
individuals with
because here comes John
COVID-19.
Campbell.
Not
that- when you think
6,815
about-
cases have been reported from
Look,
long-term care
you get
facilities.
everybody's working so
In our
hard
veteran
to
homes,
spread the disease.
there's a total census of 800 veterans between the three
harm
sites.
done if someone gets
160
the
veterans have
disease,
tested
the
positive
number of people
for
impacted,
COVID-19
the healthcare
or are
workers.
persons under investigation. A total of
Wear
45
the
deaths
mask.
have
What's
been
the big
reported.
deal?
In
It
our
can be a
psychiatric
mask, it can be a
hospitals,
cloth, it can be a
excuse me,
bandana, you
out of a
can make it
census
colorful, you can have a design, make it
of
advertising.
1,400 patients,
What's the big deal?
97 have tested
Right?
positive, or
Risk
7%.
reward is life.
Out of the staff or employees of 4,800, 237 have tested positive, or 5%.
I think there's
And
500 to
6 deaths
600
have been
DOTS
reported,
workers who have
among
now
our
been
patients.
infected. That's the
According to
physicians
data from
and
this
that's
morning,
parole.
7 laboratories
Some of them are
reporting
nurses in state hospitals.
131,967
state senators led by
tests
Tom
have
O'Mara
been performed.
is asking that you unfreeze that
58,976
2% so
have
they can
returned
see
as
that
positive
tiny amount
for a
in their
positivity
paychecks.
rate of
Would that break the bank?
44.69%.
It would break the bank.
That
You know
concludes my
how you know?
report. Thank you again for staying home
bank is
and
broken.
maintaining social
That's how you know.
distancing. It is making a
And the
difference.
state is
Stay
broke.
connected,
And there's a
stay
lot of
safe,
good
and
things
stay
I would
healthy.
like to do.
Thank you.
For a lot of good
Judy,
people.
thank you. Just a couple of quick follow-ups,
that
if I
we
may. The
cannot
counties
do
are holding the same in terms of
until
where
we
we
have
had the most
some
positive
financial
tests
stability.
in order. Bergen,
And if they want to
Essex
help,
now a little bit
tell
ahead of
them,
Hudson.
call
Hudson is third.
Washington and tell Washington
Union fourth.
that you
Middlesex fifth,
neglected the
sixth.
states' financial needs
You didn't do race
in
and
the
ethnicity, did
legislation
I
you
was making notes
passed
to myself.
was
I did. I could do it again.
wholly
That's my bad. No,
disrespectful
I
of the
don't want to make you do
reality
that.
of the situation.
We had a
And
conversation
you know that
earlier,
state governments are insolvent. You know they had to
including the Lieutenant Governor
freeze pay
and Judy and
increases. You
Pat,
know they had to
myself,
take all sorts of drastic measures. They couldn't
and others.
fund education
I
the
know
way
that
they
there was
wanted to.
a
Provide
call last
financial
night, I believe, that
assistance to
you,
state
the
governments
Lieutenant Governor,
so they can do their
Carol
work.
Johnson,
I have to go to work.
Tammy Murphy
Say it
was on the Black Doctors Association. I know Sheila is doing a town hall, I think,
One
tonight.
of the
there at
main
Ted Green,
systems,
East Orange.
right? We have these states
Trying to get
working
at this
together.
question, is
What they need
it's
to
been bouncing it
coordinate
around at
are the
around
systems. You need
50%
transportation, you need
higher
economics,
representation and
school
fatalities among
system,
African
they
Americans
all
than we
go
have
together, or none
in
of the
society writ
years
large, and
in
just sort of trying
turn,
to talk through the
unless all the
reasons for
years
that.
turn.
And Judy, the ones that I took away from our call with others were the density of the living condition, overall access or lack thereof to health, as you call comorbidity, underlying a disproportionate amount of underlying health challenges on a going-in basis to this crisis, and a disproportionate representation in the workforce that is still going to work every day. Nurses, first responders, essential workers, et cetera. Is that a fair?
It's exactly what we discussed, yes.
And so those are things that we got to continue, as they say, to unpack. And it's not like we weren't focused on those on a going-in basis before this crisis ever occurred. But now, this, like a lot of other things, this really shines a light on the weaknesses and the inequalities in our society. Again, I want to give the Lieutenant Governor a big shout out, Senator Ron Rice, who's been a leader on this from moment one. So, and on the veterans, you mentioned 45 lost lives. Just for folks out there with loved ones in those homes, 29 of them, I believe, in Paramus, 16 in Menlo Park, but none so far, and I'm knocking on wood, in Vineland. And that's something I spoke to the Secretary of Veteran Affairs about yesterday. So, again, Judy, thank you for everything, including your report. Colonel Pat Callahan, any you got on compliance, on PPE, on other matters?
Thank you, Governor. Very briefly on compliance, on overnight, Hoboken police responded to a burglary reported. Subsequent investigation led them to the arrest and charge of a subject who had broken in through a front window and was found in possession of alcohol and cigarettes. While being processed, that subject coughed at the police, indicating he was COVID-19 positive. Perth Amboy Police issued 2 executive order violations. Salem issued 1 executive order violation in the wake of a motor vehicle accident where the subject provided false information. In Lodi, up on Route 80, a Jersey trooper was pursuing a vehicle in excess of 130 miles an hour, subsequently broke off that pursuit. The subject was later identified at a gas station by another trooper who then again went up on Route 80. They did not pursue him, but subsequently had enough to charge that individual, who turned himself in up at the Total Barracks with his attorney. In Elizabeth, 3 individuals were cited for a violation of the executive order. And in Passaic, an additional 3 were cited as well for the EO violation. In Hillside, 1 cited, and in Newark, always leading the charge, 88 executive order violations and 5 businesses were shut. And although the commissioner touched upon it, Governor, I just think just one piece that is the stark reality of this is the mortuary affairs. That is a daily discussion for us. It is not an easy discussion between our chief medical examiner, the medical examiners, the funeral directors. A few steps that we've taken. DEP this week issued a waiver to allow crematoriums to extend their hours in order to assist with the stress that our systems are under. The Attorney General I spoke with this morning, he is working through Consumer Affairs to try and extend, and I think will be successful in extending the hours that cemeteries can operate. We're hearing that from our funeral directors. Beyond the mortuary trailers that we have, one component that I just will stress before I turn it back is the crisis counseling that goes along with the not normal process to have to deal with that much death. So we managed to make sure that we built that crisis counseling into all of those that are working through this mortuary affairs issue. I know we use the term resiliency a lot, and some people think that that's bouncing back. But in this instance, we're not sure people can ever bounce back, so we use the term bouncing forward, because none of us, I don't think, included us here and around the country and state, will ever really be the same. So that resiliency piece, I think, is going to be monumental as we move forward to the other side of this. Governor?
Pat, really well said. Let there be no doubt. I don't think anyone is ever going to be the same, especially folks who have lost loved ones, but even friends and broader communities. And again, we have to sometimes talk about things that are uncomfortable, and there are meetings that go on, and these 2 folks are in most of them that are not meetings you ever thought you'd have. And so thank you to each and every one of you who are part of it. And just know, folks out there, we're with you as best we can every step of the way. I will just say this, notwithstanding the compliance challenges, and you go over them in our pre-call and you went over them here, Pat, it has to be said, yes, there are still knuckleheads out there who are claiming they've got it and spitting on people and coughing, but the overwhelming compliance is just so impressive in our state. And we just have to thank each and every one of you out there, each and every one of the 9 million folks in sometimes really hard circumstances. I mentioned the density of cohabitation we have in so many communities and so many homes. It's not easy. We understand that. And the only plea I would have is we're not out of the woods. We're not, I don't think we can see the tree line yet, to be frank with you. But we will get there, and I promise you we will let you know the minute we know, or at least what we think we're getting there. And we're dealing with, we're dealing with models all the time, trying to assess, as we've said many times, best and worst case. But I know one thing, is if we fall off the wagon, if we stop adhering to the stay-at-home edicts and the stay-at-home pleas that we've made and the social distancing pleas, we will blow through any worst-case assessment on any current model we're looking at. And that number of 36,000 still hangs out there like a storm cloud. It could have been, as we said a few weeks ago at this point with the charts, it could have been 3 million of us or more getting infected. But even with all the good work we've done, we take our foot off the gas right now. We swamp, no matter how good a job these folks are doing, and they're the best in the nation right now at what they're doing, we'll swamp the boat. So please, again, thank you for everything you're doing to stay home and stay away from each other. And please, God, continue to do that. And I promise you we will let you know the minute we think it's safe to go back in the water, as they say. John, I assume there's no truth to the rumor that you sat there all night and compiled more questions, but you are in the same place you were yesterday, and with that, we owe you the first questions. Martel, thank you as always.
Thanks. Is the state tracking where people are dying, whether that's at home, in hospitals, nursing homes, and any comparison of deaths in hospitals by hospital comparison? And we're getting concerns from doctors who are concerned about practice at the hospital due to this all hands on deck, concerns about practicing outside of their specialties, practicing in emergent situations. Is the state Department of Health handling complaints about medical practices right now? Or is there anything that's popping up that you're concerned about? And Governor, you pushed back the income tax the filing deadline. What's the status of the May property tax deadline? And there's a looming sales tax payment deadline as well. Any movement on that? And last night, Governor, you tweeted about a chat with Dr. Eric Ding and his technology for contact tracing. There was some pushback by Harvard epidemiologists and others about his credentials. Is that something you're concerned about now? And can you detail what you're doing now to start doing contact tracing in the future?
Judy, I'll take a few that are on my side and hand it to you. Is that okay? Mm-hmm. Income tax, again, extended. I want to make sure folks remember this because it's April 15th, that your income tax is not due till July 15th. Nothing to report on May property tax or sales tax. I did speak to Eric last night. I was not aware of any pushback in his credentials, but we had a very good conversation. You probably have seen, because I've deliberately tweeted about this, we're trying to get, I've mentioned multiple models that Judy and Christina and their teams and I and all of us look at. We're also trying to get as many different perspectives from this, from all sides, from all shapes and sizes. And he's somebody, as you rightfully point out, John, who's been particularly good at app development, contact tracing. Nothing specific to report on that, other than we know the broad reality is, again, remind ourselves, sequencing is beat the crap out of the virus, get it down as close to zero, get it down to a manageable reality where Judy and Christina and the experts can say, okay, we're safe to think about reconsidering some decisions we've made. Then it's a responsible reopening. Again, you only get economic recovery on the back of that healthcare recovery. And you need healthcare infrastructure, you need protocols in place that frankly we don't have at the moment, that we will need before we reopen. That's you know, again, Judy will correct the record here, but at least two elements of that. Number one is broad scale testing that has a very quick turnaround. Easy to do, big numbers, you get it back fast. That's why the Rutgers work is so interesting to us and to so many, including the White House. And secondly, and Judy, I think and you and Christina would agree, you've got to have a really robust, not just in theory, but in practice, contact tracing program in place. So if you bring the community spread, if you wring that down to as close to zero as possible, you begin to reopen, you've got to have both of those elements in place, or I don't think you can reopen. And so no specifics beyond that. We're looking at lots of different models right now. I do know someone who is positive, who gave me a very encouraging readout of a conversation with a contact tracer that took place this week in New Jersey, in terms of the professionalism, the quality of the questions, the understanding by this person. I'm not even sure they were a healthcare worker. I assume they were, but it was an encouraging sign. The only discouraging part is we're so swamped fighting this war, it took a lot of days between the positive confirmation and the conversation. I think that's all I've got on this side. Back over to Judy. Is that okay? I guess, Judy, we had tracking where folks are passing and doctors operating outside of their specialties or their particular lines.
Yeah, there's so many physicians who have volunteered. I'm going to start with that, and are, just helping us in our field offices, our stations, helping out in hospitals. I have not gotten complaints, I can honestly say, from physicians. I have gotten emails with suggestions that are all very positive. And last night on the phone call with the New Jersey Medical Association, the Black Physicians Group, they brought up some really important points for us to consider, particularly those that are practicing actively in urban centers and the inability that they have to do telemedicine to take care of their patients. So it's something we have to consider. And a pediatrician brought up a really good point that we need to continue childhood immunizations. That's something you can't do by telemedicine, and it's so important because we certainly don't want to see the incidence of those childhood diseases that we can eradicate with vaccines come up again because we didn't continue immunization. So a couple of things to work on. So the suggestions from physicians have been very positive, and we're considering all of them. Maybe Dr. Tan can talk about the death certificates and how you're not only confirming the deaths through the death certificates now, but also location.
Actually, we would probably have to get back on how detailed some of that information is. Currently, what we're doing right now is that we're looking at our electronic death records. They have to go through a process of what's called registration, where the death certificates are ultimately finalized through a certain process, but we'd have to get back as far as like the level of detail of some of the information that you're requesting.
Thank you, John. Elise, do you mind jumping in? Good afternoon.
Good afternoon. We have heard from a company stating that it's been airlifting patients from New York City to places including New Jersey. Is that so? Have any more governors signed on to the regional approach to reopen, and have you come up with any target dates for any aspect of that? And regarding test kits, if you get more, can you process them? Do you have the ability to acquire test kits on your own? And what about for the Abbott quick test devices, which came with so few swabs?
I'll take a couple, and then Pat, you may want to come in addition to Judy here. I'm not aware of anybody getting airlifted to New Jersey, but that may be just me.
Yeah, I'm not either. So.
Okay. So if you have more details on that, we would like to hear it. I spoke with Mayor de Blasio last night. I probably should have said that, and we're comparing notes on a whole range of things. Obviously, they've been ground zero. The regional approach, Massachusetts got added. I'm not sure. I think that's public knowledge, Elise. Massachusetts, to the best of my knowledge, that's public. And that's important. That's a state that we compare ourselves to a lot in many respects, including health and higher education and pharmaceutical companies. Importantly, a governor, a very good guy, and a guy I've known for 48 years. I went to high school and college with him. a Republican. So it's someone from the other side of the aisle, in addition to being a good governor and a good guy. Targets on the regional approach. I think we're trying to make some announcements as early as tomorrow. Please don't hold me to that, in terms of at least who will form the membership of the council. And I think their intention was to have a first meeting of that council very quickly thereafter. And Dan, you may correct the record if you know something otherwise, but I believe that is the current, that's the current. So each of our states have been going through trying to make sure we've got, again, it's chief of staff plus a medical or healthcare expert and a real economy expert. Kits and Abbott. Any comments from either of you?
I could talk briefly just on the Abbott. I think as far as the distribution, and we could probably get you the exact distribution plan, Elise, was to keep 2 at the state lab right in West Trenton. I think a regional approach with North, Central, and Southern with our primary healthcare providers. I think the turnaround on them, even though it's 3 to 15 minutes, based upon the studies that have been done, we could probably do up 100 to 300 a day with those Abbott tests, which isn't a lot, but I think the main focus is to have them at acute care facilities and long-term care facilities, maybe where they may be, and I'd certainly defer to Commissioner Persicelli, where they may be most informative, given the struggles that we're having at our acute and long-term care facilities. Commissioner?
Judy, I don't know that this is necessarily either public knowledge or accurate, but compared to the 300 to 500, Pat, is that what you just said a day?
1 to 300.
1 to 300, pardon me. At some point, the Rutgers model, at least among others, was talking about 10,000 potentially, right?
That's what he's reporting, yeah.
Yeah. So that's I don't have firsthand knowledge of that, but that's that sort of scale. We're still trying to think through. It's fair to say, and Dr. Tan would be far more expert on this side. How many tests you'd need to be able to do a day in New Jersey to have that responsible healthcare architecture in place, so that you could feel comfortable about reopening, and it's, I suspect, double-digit thousands. So that's something we're still toying with. Thank you. Do you have something, sir, in the back? I can barely see you back there.
Hi. Dave Schatz, New Brunswick Today. I was wondering on the, if you can, I think Elise just asked you about it, but on the back to work plan and the, anything more on the different aspects of the regional, and also was wondering on the testing, if the private retailers and businesses were still in the picture as far as providing testing at their locations, like CVS?
Yeah, on the regional approach, not a lot new to report today, but it's a whole lot of discussions going on. So you got sort of, if you could think of it in sort of 3 rings. One is what we're doing in New Jersey. That's a constant, and we were having a discussion, some of us today. You've got the firefighting team, and you've got the where do we go when we put the fire out team. And whether we like it, a lot of the members of those 2 teams are overwhelmingly the same people. So that's constant. The next ring out is the regional grouping of 7 states now that Elise was asking about, and that's early stage, but each of the 7 states, it's fair to say, are having similar deliberations as to our deliberations. So our point there is to have some amount of coordination. Best practices, certainly. So if we see something that another state's doing that is really impressive, that we like, we'll have no shame to rip a page out of that playbook and apply it. But it's mostly to harmonize and coordinate. Again, under the theory that we did that when we were closing, let's do that when we're opening. Again, this is a little bit of a broader group, but I think that's a good thing. And we're the densest state in America, and this is the densest region in America, so there's a lot of commonality. And then the third ring, and that's why I've said this a lot, it's not either or, it's and both. There's also the coordination we will need and want to have and desire to have with the federal government. There's no replacing the existential reality of the federal government of the United States of America. We can't print money. They can. They've got resources that we don't have, either any one of us or even those 7 states combined, as significant a piece of the country's economy as that is. And so it's all 3 of those, and it's not one over the other. It's not one or the other. It's and. We'll continue to aggressively. We've got 66 different locations and testing sites. We're 4th in terms of total tests, only behind states that are California, 40 million people, Florida, 21 million people, New York, 19 million people, New Jersey, 9 million people. Per capita, we're punching way above our weight, but it isn't where it needs to be. It's very frustrating. It is not where it needs to be from day one. We haven't had the support that we would have wanted, ideally, particularly from the federal government, to been able to do the universal testing. So as we broaden that out, that will include, without question, private sector. I know CVS, which is based in Rhode Island, is doing that there. Those are models that we will embrace wherever we can. And again, scale will be key here. Thank you. You good, sir, on the camera? You good? You're good? You're making up for yesterday, I assume? Come on down.
Don't want you to feel left out for yesterday.
I appreciate that.
Ian Elliott for NJTV News. Colonel Callahan, yesterday you mentioned the state is expecting to receive a decontamination unit and would likely send it to University Hospital to extend the lifespan of their N95 masks. Do you have any more information on when the state expects to receive it? Governor, you say you've taken a data-driven approach to this virus in your response. Are you looking at Google mobility data, and did that influence your decision to close the parks? The April 5th report showed a 26% increase in people using parks in New Jersey.
Pat, do you want to start?
Sure.
Is that it? Ian?
I might have a follow-up if that's okay.
That Battelle decontamination system that we talked about yesterday actually arrived this afternoon, and I was misspoke when I said it would be physically at University. It's actually going to be kept in Edison, right adjacent to that field medical station. We are currently working on the logistics on the collection, how the decontamination, and then the redistribution of that. Kathy Bennett from the New Jersey Hospital Association is in the process now of sending out the fact sheets, the instructions for healthcare providers, the instructions for healthcare personnel. I would imagine that that plan is up and running with, again, a regional collection, decon, and send it back out within the next few days.
I did not on Google mobility, but I know the team did, and I know there were an uncomfortable amount of anecdotal stories that came back to us. Again, I take no joy in having parks closed. The problem is, and I know some folks have said in the rural parts of the state, you know, come on, we're less densely populated, and the answer is yes. The problem is my fear is that the entirety of the rest of the state, if not the entirety of the rest of the region, would descend on the parks that are open. And again, we had a lot of out-of-state tags in the parking lots. I forget if it's the same weekend. I assume it is. It was the first good weather weekend we had of the year. Ian, real quick, you got another one?
So are you using people's queries to the state COVID site and symptom tracker to find virus hotspots? There's nowhere on the site that seems to tell people that that's being done. Is this an invasion of privacy? And do you think people should be giving up some of their privacy during this pandemic?
If that's to me, I think we can find, I'll take your input on this, Judy and Christina. We should be able to fight the pandemic and not violate people's First Amendment rights and their right to privacy. We should be able to find common ground. And I believe so far we have. That's not to say it's without casualty, because we've lost far too many folks. But I believe it's not you don't get one. Or put it this way, I don't think it's a zero-sum game. You only get what you need if you take away people's privacy. I don't believe in that. Okay, thank you. Dave, good afternoon.
Hi, Governor. A couple of questions.
Please.
First one, right before we started here, Governor Cuomo in New York was talking about we're going to have to maintain social distancing until a vaccine is developed and or more testing is widely available, quicker testing. Would you agree with that? And the reason I ask is there seems to be this sense with a lot of people that somehow, some day in May, it's going to be like, hey, everybody, everything's getting great, and the masks can come off and the dancing can begin. Is there, I mean, what's your sense about this? What do people need to understand, do you think, about the severity of what we're dealing with here and how slow the reentry is going to be? And what do people need to understand and accept? Another question for you, Governor. State revenues for March were reportedly up 3.6. We assume this is because there's a reporting lag, especially for the sales tax. The revenue report for April that will come next month is obviously going to be very different. What's your reaction to the March numbers, and are you bracing for what we're going to learn next month, and how are you preparing for what would most certainly be a massive hit that is coming? Another question, if I may, on your encouragement. Every day you give strong encouragement to the people of New Jersey about staying strong. You were particularly passionate earlier, talking about we're doing a great job, but we can't let up. We got to keep our foot on the gas. Are you afraid that if you don't do this, people will get careless, sloppy, and stupid? And is this your nightmare scenario, that somehow people will take their foot off the gas and then the whole thing will turn into a disaster? And finally, if I may, for the commissioner who needs no introduction, could you give us even a guesstimate, Commissioner, about, you know, you give different statistics about people who die from COVID and the categories that they're in. I've heard that 99% of people who succumb to COVID are either have heart disease, immune system deficiencies, facing some sort of a serious struggle with cancer or some other debilitating disease, diabetes. Would you agree with that the vast majority of people who are dying fit into that category? And I guess obesity is in that category as well. Or do we not know enough about it?
Judy, I'll start, and you want to come in? Yeah, I think, without having seen or heard directly what Governor Cuomo said, the notion that we're going to go back to some sort of, let's just turn the clock back to 3 months ago, I just don't see it. People talk about a new normal, and I think that's a reality. I hope, please God, in his sequencing of events, that the testing in large-scale rapid testing comes a lot faster than the vaccine. I've not heard any expert, and we've tried to speak to as many as possible, from the likes of Alex Gorski, the CEO of Johnson & Johnson, to Dr. Tony Fauci and everybody in between. I haven't spoken to anybody who lives in this field, and Judy and Christina, you tell me if you disagree, who thinks a vaccine sooner than a year or a year and a half is realistic, at least that's safe and scaled. I am praying that the broad-scale testing turnaround, the saliva-like test that Rutgers is trying to develop, and hats off to them, that comes a lot sooner. But that even then, I've mentioned this example before, I can easily see the restaurant protocol, a temperature check or some kind of check of you, if it's available, maybe a quick saliva test. I don't know that's going to be that available. You go inside, the servers are masked and gloved. The wiping down of surfaces is hyper aggressive. You're at 50% capacity at most. No table. I can't get closer than I am to you, Dave, right now in terms of my table to yours. Not shaking hands. Harvard, apparently, there's some Harvard study that came out yesterday that said would be social distancing until 2022. I don't know that we're going to anytime soon go back into what I love, by the way, I have to say, big handshake, kiss on the cheek, hug, high fives. I think that's postponed for the foreseeable future. It leads to your second question, which I think I've kind of already answered, but I'm getting an enormous amount of incomings from parents, in particular of high school seniors, and I don't blame them for 1 second. It's in part related to sports. Can't we just get back to sports again? And the other part relates more to the pomp and circumstance associated with graduation ceremonies. I had an incoming today questioning a couple of religious gatherings that are currently expected to take place in June. And we have not given you the guidance on schools, and I think we're going to probably do that tomorrow, and I'm sorry it's a day later than I was hoping for, but it's for good reason. We're trying to figure all that out. I would love nothing more than to, I just don't see, I mean, I'd take my cues from the health experts, and I'll continue to, I don't see a normal, even if it were to take place, a normal gathering in the foreseeable future. I just don't see it. And I'll be the happiest guy on this planet if I am wrong. Lastly, two other quickies. The revenues are off. I don't have the numbers for you, but they're falling off the cliff. That's part of the reason I was on with Secretary Mnuchin today, underscoring the necessity the states need direct cash assistance, both how the CARES Act is interpreted and any other steps that will be taken. And it's expenses going this way and revenues going that way. And yeah, my worst nightmare, I think I said it earlier, other than the loss of life, which is far too jaw-droppingly large already, and each one of them a precious life. My nightmare scenario right now is that people get sloppy, that they get, I don't know if I'd use the word stupid, because I don't blame them for being frustrated, but they basically let their guard down. And I mentioned this yesterday, and I think you all would agree, the direct line between human behavior and what the 9 million of us are doing, and what the reality then that these folks have to figure out in terms of hospital beds, ventilators, PPE, medicines, healthcare workers, it's literally the model changes like that. And we can see from that map it's going in the right direction. But that 36,000 worst case bed need is not out of the realm, assuming folks do just how you've described it. Again, we dodged one bullet. Again, we could have had 3 million or more infected. Because of the steps we took from day one, we've avoided that awful bullet. But 36,000 beds, if we drop our guard right now, and there's no amount of work they can do, there's no amount of help from other states, there's no amount of help from the federal government that can allow us to stay above water in that circumstance. I'll put my shoe back on and stop pounding the podium. Judy, underlying in particular, any comments you've got about social distancing and how you see that, and Christina going forward. And secondly, underlying conditions, heart disease, obesity, et cetera.
Yeah, let me just give you some statistics. And the deep dive into 1,442 cases, 60% of them have identified underlying cardiovascular disease. So that's like 871 cases. Now remember, it's not unusual that if a person has one comorbid condition, they have others. So the percentages won't add up to 100. But 37% of the cases, or 533, had diabetes mellitus, and 29.6, or 427, chronic diseases, of which 20% of the cases are chronic lung diseases, which with pneumonia you would understand that would be a complicating factor. And for the immunocompromised conditions, about 15% are identifying along with that in cancer, and 11.4 or 164 of the 1,442 cases. So definitely comorbid conditions are a complicating factor for COVID-19 deaths.
Judy, one comment and a question to add to Dave's, and then we'll go to Sam after this. To your point, more than one condition, if you add up the percentages, it's about 201%.
Yeah, that's why.
So that's an important point. It's invariably more than one thing that's gotcha. Secondly, that's N equals 1,442. That's out of total death toll. It's shocking, but it's 3,156. We've been asked this before. That doesn't mean that no one else had an underlying condition. That just is the 1,442 folks that you've got visibility into.
Yeah.
Okay, thank you. Sam, back to you.
Awesome. Thank you, Governor. A couple questions from me and then one from WNYC. Yesterday, a lot of reports out of Illinois about Governor Pritzker working to keep the details of his state's shipments of PPE and ventilators from China secret out of concern that the feds would seize those materials. I know that New Jersey is obviously sourcing PPE abroad. Are you at all concerned about the feds taking whatever you can find from China or Taiwan or wherever, should that come to our shores? And did this come up in your discussions yesterday with Wong Ping? Second question has to do with triage guidelines. I understand that there's no exclusionary element in those guidelines, but the scoring system clearly prioritizes those who don't have conditions with high comorbidities like heart disease or diabetes. I know that this is only supposed to be used in the worst case scenario, and I understand that there's no tolerance for discrimination or bias here, but given the high prevalence of those conditions in the African American community, and given that these guidelines are supposed to take lifespan into account, don't they somehow reinforce some of the implicit biases that exist currently in the application of healthcare? And last question from WNYC, I think it touches on some ground that John covered earlier. New York City has now begun to release the number of deaths that occur each day at home, as opposed to just reporting the deaths in hospitals. Will New Jersey begin to provide that data? And until then, can you give us a sense of what you're seeing in terms of deaths at home?
Let me start. Is that okay, Judy? And then we'll jump in. I think on the last one, we're going to defer as we did with John. I think Dr. Tan said that's something we want to come back to. And Dan Bryan, can you make sure we follow up both with John and Sam on that? And the extent to which we have the data, we will share it with you. There's nothing we're holding back from you. So let's come back to you on that if we could. I'm not aware of it. I wasn't even aware of Governor Pritzker's situation. I'm not aware of anything untoward in terms of seizing anything. In conversations that you have with governments, this was part of the conversation with China, is you want to make sure that the customs folks on either side of this understand where this is coming from and what its intended use is. And so you're constantly looking for help and raising that as a factor. That's hearkening in my case back to being a U.S. ambassador. That's a fact of life. But we've seen no evidence of anything untoward on that. We just don't have enough PPE, and we're constantly out there fishing. I would just say Judy's going to take the so-called triage guidelines. We are hyper-focused, overwhelmingly focused on the nothing exclusionary and no discrimination piece of this, and we mean it. And we expect all the healthcare providers in the state to also mean it and act on that basis. The last thing we need right now as a state, with inequalities that already exist in peacetime before this ever came upon us, is to have those inequalities exacerbated. It's why leadership from the African American community, the minute there was a press article about one of the providers doing something that was not consistent with Judy's guidelines, why they came immediately to me and raised this rightfully. We will do everything we can to avoid that at all costs. But Judy, please take away any specifics.
Sure. Let's talk. You brought up a really good point about implicit bias, because we do know that it exists. It's institutional bias. It exists throughout all of healthcare. The allocation policy requires that there's groups of people that help make the decision, and the directly treating physician cannot make the decision. Hopefully that that group will be able to control for the bias that we know exists, prior to pandemic. As far as the underlying comorbid conditions, there are no exclusionary criteria, and there's degrees of underlying conditions. You may have cardiovascular disease that required you to have a stent. That's not an exclusionary criteria, and it does not perhaps affect your lifespan. So it doesn't necessarily mean that you're going to be excluded because of it. We all have some underlying conditions, especially as you get older.
Thank you. Matt, we're going to close this out with you, if that's okay. Give us a sec.
Just before jumping on, I'm wondering if you've answered Sam's...
We got to get you the mic up close to you there.
Curious if you just answered Sam's last question about the whole issue of undercounting deaths. that New York.
We did not. We said we actually need to come back to that.
Oh, apologies. Okay, so
No problem.
a couple.
But thanks for looking out for Sam.
So, Governor, curious, and Commissioner, has any nursing homes been cited for violations during the outbreak so far? If so, which ones? I'm curious if you can confirm any deaths of employees at the psychiatric hospitals or developmental centers. Governor, from another outlet, curious if New Jersey is the only state ordering everyone to wear masks in stores. Have local police been asked to help stores enforce this order? And has anyone been cited for violating the order? Is that something that you folks will keep stats on? And lastly, off topic, Governor, the Department of Justice concluded Monday that the state's women's prisons for years has ignored rampant sex abuse by prisoners by staff. The feds say in your administration cooperated with their investigation, but has, quote, failed to fix things. I'm curious what your reaction to the report was and what you plan to do going forward about it.
Judy, I'll leave the nursing homes to you. Obviously, it's an area, and the psychiatric and developmental homes, in terms of, you asked about employees in particular, right? Can you stay close, Martel? Was that, you asked about employees in particular on the?
Employees, yes.
Yeah. I'll deal with the off-topic one because Pat can deal with the local police and the stores. In fact, we do have some experience with that being enforced, so Pat can go through that. This was now, I think, on Monday or yesterday. This came out on Edna Mahan in particular. This is a situation that existed as we came into office, and we've taken a whole range of steps since then. We have a new commissioner. I signed a whole series of prison reform laws. We have an all-female advisory board. There have been a number of training protocols that have been put into place. It is something that was a complete and utter, not just mess, but a deeply troubling situation. And we've taken, again, I don't have the list in front of me, we've probably taken somewhere between 10 and 15 steps between laws signed, new leadership, protocols observed, et cetera. So it's a black mark without question in the corrections history in our state, and frankly, it's a black mark in our state's history. Again, and I'm not dodging it in any way, shape, or form. It's a situation we inherited, and we have taken a whole range of steps to redress and address the situation that we inherited. And let me just say that we continue. This is one of these situations that each and every day we try to get better than the day before. Judy, do you want to hit first Matt's questions on nursing home violations, if any, as well as psychiatric and developmental homes?
Yeah, we have not cited anyone what we would call a quote-unquote violation. We have gone out to, with the local health officers, by the way, we have gone out to some of the nursing homes to help correct what are really daunting situations where staff has called in sick or have abandoned the nursing home, and they needed some extra, some oversight and some extra help. We still need help in our nursing homes. That's why we're trying to call up as many nurse aides as we can. The staffing and the PPE continue to be a problem. We did I think I reported yesterday, we did send a significant allocation of PPE to our nursing homes, and today or tomorrow we're fitting our survey team with N95s because we expect that they'll be making board visits. On the psychiatric institutions, out of a total staff of 4,800, 237 of our employees have tested positive. That's 5%, and we have had 2 employee deaths.
Pat, do you want to hit the
Yes, sir.
enforcement in the retail section?
Sure. We did, as recently as yesterday, there was a subject in Pleasantville that was cited on Saturday, cited on Sunday, and then because of his persistence and failure to abide by that, the last charge was put on a warrant, which means that he was lodged in a county jail. So it is one of the charges that we ask all law enforcement to track and report on a daily basis to our Regional Operations Intelligence Center, Matt.
I just say before we break, on the long-term care facilities, we said this yesterday, Judy laid out a whole series of steps that have been taken now for measured in months. And we continue, notwithstanding not citing violations, we continue to, through her offices, through mine, through others, pounding away on these operators to do everything they can in their power. Obviously, we're providing them, as Judy said, with trying to address a huge shortage of PPE, but also to do the right things by these folks, and including notification of loved ones and status of the facilities. The comorbidity question that you triggered, Dave, is none more true than it is with long-term care patients, right? So you get an overwhelming overlap between underlying existence, age, et cetera. This is not a New Jersey unique situation, but when we all do the postmortem, and we're going to do, as a nation, please God, we do an aggressive postmortem that is in the spirit of the 9/11 Commission, led by Governor Kane so well with Congressman Lee Hamilton. It must be done. It cannot be partisan. New Jersey, I promise you, if we have anything to do with it, we'll do something very similar. But it's pretty clear, and I'm going to start putting this on, it's pretty clear that a big weakness in the system is in the reality is long-term care facilities. We're going to close down. We'll get to you, though. We're going to sweep across once every day, and just in the interest of fighting the fire, we got to get back to the shop. But Dan, if John may have a follow-up that you could get. So we'll be back here at 1 o'clock tomorrow. The White House VTC is right now scheduled for 3 p.m. tomorrow. So we will be here at usual time at 1 p.m. Obviously, if there's something material to report between now and then, we will. I want to thank the Commissioner, Judy Persichelli, Dr. Christina Tam, our epidemiologist. Thank you, Doctor. Pat, thank you. Jared, thank you. To Paramel. And again, to each and every one of you, keep doing what you're doing. And if we keep doing what we're doing, we will get through this. As you rightfully asked, the new normal probably won't look like the old normal, at least at first. But we will get through this together, stronger than ever before. Thank you all.
and masks. Because what you get today is only 2. But when I want to get it more, and our councilwomen been helping the state assembly, that we're going to do it, you know, for Van Dyke and everybody else, every president, but I can't worry about everybody else in different developments because they got presidents. But here, this is not the end. This is just the beginning. And the next voice you hear after Joyce Evans is our borough president, Eric Adams.
Continue, God, to try to understand what is going on. God, I know you are in charge. And I know I need my relationship with you to be a relationship with you each and every day. We thank you in Jesus' mighty name, Lord. Amen.
Thank you so much. Ask and instructions, simple instructions. We did this in Spanish and English. And as we go to other communities, we're also doing in their communities. And this is the first wave, as Lisa pointed out. We want to continue to give you the mask and information and all that you need to survive coronavirus. The survival of coronavirus cannot be in affluent areas. Coronavirus does not discriminate, but our policies and protection has been discriminating. And we want to stop it from discriminating throughout this entire city. They should not be. Our goal, if you remember a few weeks ago, 3 or 4 weeks ago, we came to NYCHA to hand out masks. And people criticized us. They said, why are you giving NYCHA residents masks? Because I knew those who are more likely to die from coronavirus had pre-existing conditions like asthma, diabetes, heart disease, things that are in your community that you have been fighting for. And I knew that not only must we have intervention, we must have prevention. And by giving you real information and real tools, it can allow you to prevent getting coronavirus. We have reportedly 12 people we know died in the last 2 weeks, probably even more. We have people who died, and only because of the decomposed bodies were we able to find them. And so Lisa and her team and the councilwomen have been on the ground. This is what's needed. From feeding people, giving them food, to giving masks, to being here in a real way. And let me tell you something. I'm not going to tell my transit workers to go out. I'm not going to tell my supermarket employees to go out. I'm not going to tell Lisa to go out. I'm not going to tell my 11 operators to go out. I'm not going to tell them to go out in harm's way, and then I'm going to sit home and telecommute this virus away. I will be out here on the ground with you every day. That's what you elected me for. That is what I'm going to do. We're going to fight and defeat coronavirus together. That is my commitment and promise to you. And so, we're going to hand out a few here. Continue to hand them out. But we want you to practice social distancing. We want to make sure you your seniors, call them, make sure they're okay. If you feel ill, make sure you report it to your doctor, because we want to prevent it We want to make sure you get the services you need. Thank you very much. Lisa, you can decide how you want to do it.
Excuse me, everybody. We're gonna have order, and the line starts from there. I don't want nobody come bum rush. You know me about bum rushing. I don't play that bum rushing. So you got to get on the line. The line is all the way there, around there. We're going to do this. We're going to act right. You know, can't let people take your peace and joy. You know, I heard domestic violence is up. And it could be from the men to the woman. I said around that way.